All right, Ninja Nerds, in this video we're going to talk about the vagus nerve or cranial nerve 10. This is a very, very important nerve. Out of most of the cranial nerves that we've talked about, this is probably of the most important nerves. And the reason why is it supplies so many different structures. Now we're going to talk about a decent amount of them, but we're going to talk a little bit more in detail about the thoracic and the abdominal viscera, that parasympathetic supply and GVA supply, more when we talk about the sympathetic and the parasympathetic nervous system in the autonomic videos. Okay, but for right now, let's go ahead and dive right into the actual vagus nerve. So as always, we're going to talk about where the nerve originates. We're going to talk about the course of the nerve. We're going to talk about the structures that it supplies, the functions of those structures, and then some just very basic clinical correlations. In this video, we won't discuss too many, and the reason why is that I'm going to tell you is that we're going to talk about it in more detail when we talk about the parasympathetic nervous system in the autonomic videos. All right, so let's go ahead and dive right in here. So first things first, let's go through each fiber. So the vagus nerve has, again, so many fibers. It has GVE fibers, it has GVA fibers, it has GSA fibers, it has SVA fibers, and it has SVE fibers. Okay, so when we talk about the GVE fibers, these are the secretomotor fibers. So these are part of the parasympathetic nervous system. This is the ones that I said we'll talk about briefly, but we'll talk about it more within the parasympathetic nervous system. So again, these GVE fibers are part of the parasympathetic nervous system. The GVA fibers are going to be very important too, which we'll talk about in the parasympathetic nervous system, as well as other different chapters. Okay? The GSA fibers are going to be your touch, pain, temperature fibers. The SVA fibers we'll talk about for the taste within the epiglottis and a little bit of taste buds within the pharynx. And the SVE fibers, the good old SVE fibers. If you remember, the SVE fibers are special visceral efferents, and they're supplying those muscles that were derived from the pharyngeal arches. The vagus nerve is supplying those muscles that were derived from the fourth and sixth pharyngeal arches. Okay, so let's go ahead and start off first. Let's do the easy one. Let's start off with the GSA fibers. So the GSA fibers are pretty simple. And these are going to be, again, your touch, pain, temperature fibers. So that's the first one we're going to focus on. So GSA fibers are going to be your touch, pain, temperature fibers. So what are they supplying? Okay, these guys are pretty cool because they're going to supply a lot of the structures that we've talked about already. They're going to supply the tympanic cavity. Okay, so they're going to supply a little bit of the tympanic cavity. They're even going to supply a little bit of the tympanic membrane. They're even going to supply the external acoustic meatus. And they'll go behind the ear and supply a patch of skin behind the ear. Okay, so what are these guys supplying so far? These GSA fibers. So what are these fibers here? GSA fibers. General somatic afferent fibers, touch, pain, temperature fibers are supplying the tympanic cavity, the tympanic membrane, the external acoustic meatus, and a little bit of skin behind the ear, a patch of skin behind the ear, or remember you call it the auricle or the pinna. Okay, so it's supplying these structures. So these are GSA fibers, and they're going to be general somatic afferent fibers. What's really interesting about these guys is they have a ganglia. They have a ganglia, but this ganglia is actually located a little bit more superior to the other one. You know, they call this one the superior ganglion of cranial nerve 10. Okay? They also give it another name. You can also call it the jugular ganglion, okay, because it's very close to the jugular foramen. So you can also call it the jugular ganglion. All right? So what happens is these GSA fibers are actually going to come from the tympanic cavity, tympanic membrane, external acoustic meatus, the behind the ear, or the auricle or the pinna, and it's going to take these fibers to the superior ganglion of cranial nerve 10, or the jugular ganglion, and then it's going to move through this hole called the jugular foramen. Now, after it moves out, it'll start moving towards the medulla. But what happens is it gives off a little recurrent branch over here that's going to go and supply the meninges. Oh, those good old meninges, right? Remember we showed that in like this kind of like orangish color here? So it's going to give a GSA fibers for pain, right, to the meninges. All right, this is an important branch here. So it gives a meningeal branch, and it gives a auricle branch. So there's two branches here. What is this one right here? This is the auricle branch. I'll put A for auricle, and then this one, oh, I'm sorry, not A. This is not the ear. This is inside the freaking skull cavity right here. This is the meningeal branch. I'll put M for meningeal. And this one over here is going to be the auricular branch, A for auricular. Now, it comes into the medulla and it goes to a specific area within the medulla. And that area that it goes to is actually called the spinal nucleus of the trigeminal nerve or cranial nerve 5. So what is this nucleus here called? This nucleus here is called the spinal nucleus of cranial nerve 5, or the trigeminal system, right? Sweet, got that one done. GSA fibers done. Put them in the bag, get them out of here. All right, so now let's do the next one. Let's go ahead and do the SVA fibers, because these aren't too crazy either. Let's do the SVA fibers. Okay, so SVA fibers is going to be the next one. So SVA fibers are going to be for taste. They're special visceral afferent. They're going to be for taste or gustation. But these ones are very interesting. If you remember when we talked about this in the gustation video, remember there's going to be a little bit of taste buds here on the epiglottis? And there might be a small amount of taste buds located within the pharynx. But primarily it's going to be the taste buds located on the epiglottis. These SVA fibers are going to be picking up SVA, so taste sensation, right? So sweet, salty, bitter, sour, umami, all those different types of taste, and it's going to go to a special ganglion. Do you know there's going to be a ganglion right here? It's a little bit more inferior. It's an inferior ganglion of the cranial nerve. 9. So this is your inferior ganglion of cranial nerve. Not 9, 10. All right. You know they give it another name? The nodose ganglion. No clue why, but they call it the nodose ganglion, or the inferior ganglion of cranial nerve 10. These central processes from these SVA fibers come from the epiglottis, primarily the epiglottis, a little bit from the pharynx. It's going to take these fibers up through the jugular foramen, right, from this inferior ganglion. Out of that, it's going to come out of the jugular foramen into these posterior cranial fossa, and it's going to go to a specific, it's going to go into the medulla and go to a special area located within the medulla. What is this area in the medulla that it's going to supply? It's going to go to a specific nucleus called the nucleus of tractus solitarius. Sweet. And these are, what fibers are these? These are your SVA fibers. These are your taste fibers, right? Okay, done. That's it. SVA fibers, done. GSA fibers, done. Let's do the SVE fibers. This one's a little bit more complicated. Okay, let's do these ones in blue then. Okay, so the SVE fibers, they're going to be gaining these are motor fibers. Remember, SVE fibers are motor fibers. They're special visceral efferent fibers. They're going to be coming from a special nucleus, right? A special nucleus right here. What is this nucleus called? We talked about it when we talked about the glossopharyngeal nerve. This one is called the nucleus ambiguus. Nucleus ambiguus. The nucleus ambiguus is going to give off these motor fibers, these special visceral efferent fibers. When these guys come out, right, the vagus nerve is going to continue and continue and continue, and it's going to give off some actual branches over here. You know who else is actually running with the vagus nerve? We have another nerve running with him. We're not going to talk about him all that crazy here, but it's actually cranial nerve 11. You know cranial nerve 11 is, let's actually not draw it there. Let's do it over here so that we have more room for other things. So cranial nerve 11 is also going to be running with the vagus nerve because you know it's the main motor nerve. And most of the internal branches of the accessory nerve is going to go with the what? The vagus nerve. Okay? We're just going to mention it there. Okay? Now, let's continue with the vagus nerve. But remember, it is running, this accessory nerve is running with the vagus nerve. And the reason why is it's going to give most of the motor fibers that are going to supply the pharynx. Okay. These motor fibers that are coming through here, it's also going to have another nerve with it. We'll just do this one in green really quick. Again, it's going to also be coming here. It's going to be the cranial nerve 9, or the glossopharyngeal nerve. It's going to move with this guy. The reason I'm mentioning all of these is these bad boys form a plexus. They also might even have a little bit of other fibers with them too. But all of this structure here is called the pharyngeal plexus. So what is this whole structure here called? It's called the pharyngeal plexus. Okay. Now let's just follow the vagus nerve for right now, just the vagus. The vagus is actually going to give supply to parts of the pharynx. There's these little sphincter muscles, basically. They're kind of like sphincters. And they're wrapping around the pharynx at the superior part of the pharynx, the middle part of the pharynx, and the inferior part of the pharynx. What are these muscles called? They're called the pharyngeal constrictors. So what is it supplying here? It's supplying the superior, the middle, and the inferior what? Pharyngeal constrictors. So I'm going to put PC, pharyngeal constrictor, pharyngeal constrictor, pharyngeal constrictor. So they help with basically the deglutition process, being able to contract the pharynx and squeeze the food downwards or inferiorly to go into the esophagus. Let's say that we cut it off around this part here, and we'll say that from this part downwards, this is esophagus. So from this part downwards is going to be esophagus. Okay? This part here upwards is pharynx. Okay, so we know one branch so far. From the pharyngeal plexus is going to supply that, but guess what? It even has more supplies. It actually continues anteriorly, and goes and supplies most of the muscles of the soft palate. What are some of these muscles? Oh my goodness, there's so many of them. There is the palatoglossus, which basically, the palatoglossus is a muscle that kind of pulls the back of the tongue upwards. There's another muscle. All these are important for the deglutition process, which is basically the swallowing process, right? So that basically there's two phases of deglutition, the buccal phase and the pharyngoesophageal phase. It's important within both of those processes, right? So now, because it's involved in that deglutition process, that's important to pull the back of the tongue backwards. Also, there's another one that pulls the actual pharynx upwards. It's called the palatopharyngeus. There's another muscle that also does that called the salpingo. I don't know where the heck they come up with these names, but they're called the salpingopharyngeus. It also elevates the pharynx, and it's close to the auditory tube. So it actually can pull in the auditory tube to kind of equalize the pressure between the tympanic cavity and the atmosphere. Okay? So that's the salpingopharyngeus. And then it supplies, we said, the superior, middle, inferior pharyngeal constrictors. Ooh, and the levator, villi, palatini, so that actually elevates the palate. And there's also the muscles of the uvula. We're not going to go over anymore. Okay, so that's actually pretty much most of them anyway. So it supplies the palatoglossus, the palatopharyngeus, the salpingopharyngeus, the levator, villi, palatini, and even the muscles of the uvula. All right, sweet deal. We covered that part of the SVE fibers. Sweet, sweet, sweet. Okay, now there's another part here. Okay, so let's continue on here. This other fibers here are going to come down. So that's the pharyngeal plexus. There's another one over here that's going to come over here. This is another branch, and it's still a part of the SVE fibers. This branch here, so that was the pharyngeal plexus. This branch here is a little bit more complicated, not too much more, but a little bit interesting of a nerve. This one is actually called the, specifically the superior laryngeal nerve. What does the superior laryngeal nerve do? The superior laryngeal nerve will continue, and it'll get close to the larynx. So it's going to come here to the larynx. Let's follow this guy upwards. And what's going to happen is it actually gives off two branches. One of the branches is called the internal branch of the superior laryngeal nerve. So it'll give off an internal branch and an external branch. We are more concerned with the external branch. So we'll show this here, but these really, I'm doing it here for the sake of showing the bifurcation point, but these internal branches, not SVE fibers. It's actually going to be a little bit of the GVA fibers. We'll talk about that a little later, okay? But now, this external branch is actually going to supply some muscles in this area. What muscles is it going to supply? You know, there's some muscles in here, two main muscles that it's going to supply. Okay, let's say here's one muscle, and let's say here's another one. Okay, this is not anatomically perfect, it's just for the sake of knowing what it supplies. Okay, it's going to supply to two muscles. Let's say one of the muscles, there's two muscles here. One is going to be called the cricothyroid muscle. So one's the cricothyroid, and the other one is called the cricopharyngeus. These muscles are helping to be involved within the phonation or speech production. So they're involved within the speech production or phonation. There's another thing that we have to talk about. There's another branch here. Other SVE fibers here. Let's kind of bring it like this now. This next branch here is called the recurrent laryngeal nerve. Now there's two, what happens is the vagus actually, there's a right vagus and a left vagus. We'll talk about a little bit more detail when we get to the thoracic and abdominal viscera. For right now, I just want you to know that the recurrent laryngeal nerve is going to be another branch, but there is a right and there is a left. And the reason why I'm saying that is that the right actually comes up underneath the subclavian artery, whereas the left recurrent laryngeal nerve actually comes up underneath the aortic arch. So a little bit different in the course. But for right now, we're not too worried about that. I just want you to know that this nerve right now that I'm moving with is called the recurrent laryngeal nerve. Okay, so the recurrent laryngeal nerve is also pretty interesting. What the recurrent laryngeal nerve does is it actually gives off a branch here. It gives off these inferior branches. Okay, so what are these inferior branches going to do? These branches here from the recurrent laryngeal nerve, it's going to give off these branches here called the inferior laryngeal nerve. The inferior laryngeal nerve is going to go and supply a ton of different intrinsic muscles of the larynx. So it's going to supply a ton of different intrinsic muscles of the larynx. So what is it going to supply here? What is this nerve here called? What is this one here called? It's called the inferior laryngeal nerve. It's going to supply the intrinsic what? Muscles of the larynx. Like what? Oh my goodness, there's so many of these too. There's these things called the cricoarytenoid muscles. So you actually have a posterior and a lateral cricoarytenoid muscles. You even have what's called a transverse and oblique arytenoid muscles. And then you even have what's called a thyroarytenoid muscles. Why am I mentioning all of these? Because all of these muscles are involved within speech production. So which muscles are involved in basically the speech production? The cricopharyngeus, the cricothyroid, the posterior and lateral cricoarytenoid muscles, the transverse and oblique arytenoid muscles, and even the thyroarytenoid muscles. What are they all involved in? They're all involved within phonation or speech production. How exactly? They're basically all functioning because you have these things called vocal cords, true vocal cords. What these muscles do is they pull on those vocal cords and they make the vocal cords really, really tight by increasing their length, and they make them tense. So if the length of the vocal cords is increased, and if the tension on the vocal cords is increased, whenever air moves up against them, it helps to be able to produce those buzzing sounds that resonates within the larynx and the pharynx and even within the oral cavity to produce sound, phonation, the production of speech. Okay, sweet. So that's that part. And again, what was this nerve right here? It's called the recurrent laryngeal. I actually spelled that wrong. There should be two R's, not two C's. Recurrent laryngeal nerve. And again, just remember there is a right and there is a left. The only reason I'm saying that is because the right goes underneath the subclavian artery to go into that area there, and it ascends posterior medially. The left actually comes underneath the aortic arch and ascends posterior medially. Okay, but for right now, we know the recurrent laryngeal nerve gives off inferior laryngeal branches, which supplies the intrinsic muscles of the larynx, like the posterior and lateral cricoarytenoid, like the transverse and oblique arytenoid muscles, and the thyroarytenoid muscles. All right, cool deal. Now, to continue with these, I want to bring some other fibers with them. This is why I can get a little dicey in here. Okay, so we've covered pretty much the SVE fibers. Now what I want to do is I want to bring with some of these the GVA fibers and even a little bit of GVE fibers. Okay, so moving with the superior laryngeal nerve, there's actually going to be some GVA fibers. Let's make these GVA fibers green here. So moving with the superior laryngeal nerve, you're going to have these GVA fibers. They're going to move with this actual superior laryngeal nerve, and they're going to be the main internal branch. So they're going to be the main internal branch of this nerve. The internal branch is actually going to pierce through the thyrohyoid membrane. And what is it going to do? It's going to supply the mucosa of the larynx above the true vocal cords, or above the vocal cords in general. Primarily the true, though. And it's going to give sensations to the epiglottis, the mucosa of the epiglottis. So what is this GVA fibers doing? These GVA fibers, which means that they're going back, they're picking up visceral sensations from where? From the mucosa of the larynx above the vocal cords and the mucosa of the epiglottis. Okay. What other fibers are moving in this area? You know, with the recurrent laryngeal nerve, there's also going to be some GVA fibers. These GVA fibers are also going to be coming where? They're going to be moving with the inferior laryngeal nerve. And they're going to be supplying the mucosa of what? The larynx below the true vocal cords. Okay? So just to make sure that we have this straight, there's GVA fibers moving with the superior laryngeal nerve, which are going to the mucosa of the larynx above the true vocal cords and the mucosa of the epiglottis, like the valleculae. And there's GVA fibers that are moving with the recurrent laryngeal nerve that are moving into the inferior laryngeal nerve and giving branches that goes to the mucosa of the larynx inferior to the true vocal cords. Holy crap, we got that done. Okay, unfortunately there's other structures here too. If you guys remember this structure right here? We had the carotid bodies right here, the carotid bodies. And if you guys remember from the cardiovascular system, we also had these things called what? Aortic, sinus, and the aortic bodies, right? So you had the aortic bodies and you had the carotid bodies, right? All these dudes here. There's GVA fibers from the vagus nerve that are coming from what? They're coming from the aortic arch. So there's GVA fibers that are coming from the aortic arch, and there's going to be GVA fibers that are coming from the what? The carotid bodies. Now, where do these suckers go here? Where do all these GVA fibers go? I just want to make sure that these are separate. So these GVA fibers, which are basically like a carotid sinus branch, carotid body branch, and a aortic arch branch. These GVA fibers will move upwards, and they'll come to a ganglia. You know they have a ganglia here? It's actually an inferior ganglia. So it's actually a part of the inferior ganglion, right? Or what else would you call it? The nodose ganglion. And these fibers will move inwards here. Where else would they be coming from? The GVA fibers from the superior laryngeal nerve, and you'll also be having the GVA fibers from the what else? Recurrent laryngeal nerve. All these bad boys right here are going to be moving into the inferior ganglion, or the nodose ganglion, and then where? They'll go into through the jugular foramen, and then from the jugular foramen they'll go to the dorsal nucleus of vagus. Okay? Oh, and also not just the dorsal nucleus of vagus, also they're going to go to the nucleus of tractus solitarius. And again, it's a little bit of that controversy there where it says that it could go to the nucleus of tractus solitarius, and small amounts of it can go to the dorsal nucleus of vagus. The main function of the dorsal nucleus of vagus is going to be for the GVE fibers, the parasympathetic nervous system fibers, okay? So if we want, we could really say that very little of it is going to the dorsal nucleus of vagus and most of it is going to the nucleus of tractus solitarius, just to revise that statement, okay? Okay, now, we've covered most of the GVA fibers. We're going to talk about them again when we get into the thoracic and abdominal viscera. But for right now, we've covered most of them for right now. Okay. Now, we have some more branches. Oh my goodness, right? The vagus nerve, before we start getting ready to go into the thoracic and the abdominal viscera and talking about a lot of these plexus, I want to talk about something else here. There's another thing here. These parasympathetic fibers, these GVE fibers, they can actually, there's some of them that can actually move with the recurrent laryngeal nerve. So some of them can actually move with the recurrent laryngeal nerve. And what happens is, from here, these parasympathetic fibers can come and give off branches that supply a little bit of the esophagus. And it can give off branches that come over here and supply parasympathetic fibers to the trachea. Okay? So just so we're clear here, these GVE fibers, which are going outwards, they're going to be going and supplying secretomotor fibers and muscles that are going to be, it's going to be providing fibers to the esophagus for peristalsis, and it's going to be providing fibers to the trachea for like secretion, right? And maybe even constriction too of the smooth muscle in the actual trachea, right? So again, what is it doing here? You're going to have these GVE fibers, and these GVE fibers are going to be giving off branches to the esophagus and other branches to the trachea, which is running along with the recurrent laryngeal nerve. Okay, now we're going to get into a little bit more of the complicated stuff over here. So now we're going to go over into this side of the diagram and talk about some of the actual thoracic and abdominal viscera. So we can keep going with those GVA fibers and those GVE fibers. But for the most part, we've talked about the GSA, we talked about the SVA, and we've done the SVE. And we've done a decent amount of the GVA. Now for the big ones over here, this is where it's going to get a little hairy. The main thing over here that we're going to talk about is the GVA again. So we're going to finish up with the GVA, and then we're going to finish up with the GVE. Okay? Okay. So now there's some more branches. All right, so let's go ahead and show these branches together. I'm going to actually make them one color, and the reason why is most of the GVA fibers and the GVE fibers in this area are going to be going to the same places. If there is a little bit of difference, I'll add an extra color in there. Let's make this color, let's make it this actual purple. Let's make it purple. Okay, so now from here, let's say that we have the vagus nerve. Let's say that we have the vagus nerve right here, and we start following some of these actual GVE fibers. Let's do the GVE fibers, and then we'll add the GVA fibers in. So some of these GVE fibers, which are going to make purple for right now, it's going to move downwards. As it moves downwards, it's going to give off many, many different branches, okay? It's going to give off a branch like this, okay, which is going to be going to the lungs. It's going to give off a branch that's going to go to the lungs. You know what this branch is actually called? It gives off bronchial branches, that these bronchial branches eventually come together and form this large structure here that supplies a lot of the lungs and some of the surrounding tissues around the lungs. This structure right here is called the pulmonary plexus. So again, what happens is as the vagus nerve continues down, it gives off bronchial branches, an anterior and a posterior. And those anterior and posterior bronchial branches will actually give off and come together and eventually form what's called the pulmonary plexus. All right, sweet, and that's going to supply the lungs and some of the associated bronchi, all right? And these are going to be GVE fibers that can come to this area for secretion or for contraction. Now, what can be coming with it? If we're just doing this to be consistent, let's make these in black here. If we have these GVA fibers, let's say that we have here these GVA fibers. These GVA fibers can actually move where? They can go and supply the lungs. And they can also give off fibers that can go to the parts of the trachea and the bronchi. What do I mean? If you remember from the respiratory system, we had stretch receptors and different types of irritant receptors. If you guys remember that, these irritant receptors or stretch receptors are actually connected to the afferent fibers of the vagus nerve. Well, what's afferent? It's the general visceral afferent fiber. So when you stretch the lungs or when there's some type of irritation within the lungs, you can activate the afferent fibers of the vagus nerve and that'll send it up. What fibers are these black fibers? That's the GVA fibers. Okay, so the GVA fibers are these afferent fibers that are coming from like stretch receptors or maybe even irritant receptors like within the bronchi or even in the trachea. All right, cool. Now, as this vagus nerve continues downwards, so let's continue this bad boy downwards. It continues downwards and it gives off a boatload of branches here. So we're going to kind of bring these out like this. Okay, so it gives off what's called a different types of cardiac branches. Okay, so to give off what's called a superior cardiac branch, it'll give off an anterior cardiac branch, and it'll even give off a thoracic cardiac branch. And what happens is all of these branches will actually become a part of a very, very important structure that goes to supply the heart. You know, inside the heart, there's actually going to be these intramural ganglion right here, these terminal ganglion, intramural ganglion that'll go to the heart. What is this structure here called? This is the cardiac plexus. Okay. So again, what is this structure right here? You can have what's called a superior cardiac nerve. You can have an inferior cardiac nerve, and you can have a thoracic cardiac nerve. And these guys may come together and provide this deep structure called the cardiac plexus, which might synapse on cell bodies of the postganglionic motor neurons within what's called a intramural or terminal ganglion, which is basically in or on that target organ, in this case, which is the heart. What's the function of that? The function of these GVE fibers is to basically slow down the heart rate. You know, the SA node and the AV node? Remember the SA node and the AV node, which are basically acting as those conductive structures, so the SA node and the AV node. The whole purpose of this vagus nerve on this area is to do what to these guys? To slow down their action potentials, to produce a decrease in the heart rate. That's the function of these bad boys. All right, cool. Now, we got to keep going here. Now, from here, the vagus nerve will also give off another branch. It'll give off this next plexus here, which will come around and supply a lot of the esophagus right here. It's going to supply a ton parts of the esophagus. What do you think this is called? The esophageal plexus. So it's called the esophageal plexus. So this right here is called the esophageal plexus. What do you think it's going to do with the what do you think the esophageal plexus is going to do? Whenever you're eating food, it's going to help to be able to produce this peristaltic contraction, alternating waves of contraction and relaxation to push the food downwards into the stomach. Simple as that. Then, from the esophageal plexus, it gives off two branches, an anterior branch and a posterior branch. And what are these called here? Let's say that this is called the posterior gastric nerve. And let's call this one over here the anterior gastric nerve. And this is basically going to supply the stomach. So it's going to help with the peristaltic contractions of the stomach, the mixing of the stomach, the churning of the stomach, the mechanical digestion of the food within the stomach, right? So we have the esophageal plexus, which is a branch of the vagus nerve, which causes peristalsis of the esophagus. We have anterior and posterior gastric nerves, which are going to supply the stomach to help with the peristalsis of that. This sucker just keeps going. Okay, now I got to be just a tiny, tiny bit more specific. Okay, this guy here is going to go where? This vagus nerve is going to give off branches here. Now, I have to be very, very particular here. And the whole reason I'm saying this is because we actually have what's called a right vagus and a left vagus, right? The left vagus and the right vagus supply different types of plexi, okay? So the right vagus is actually going to give off a branch. Let's actually say it's right here. It's going to give off a branch here that's going to go to what's called the celiac plexus. Okay, it's going to go to what's called the celiac plexus. And the celiac plexus supplies a boatload of structures. It supplies the adrenal glands. It supplies the kidneys. It supplies the intestines. So like the large intestine, the small intestines. It supplies the pancreas. It even gives branches all the way out here to the spleen. So it gives many, many branches. So what is it going to supply? This celiac plexus, which is coming from what vagus nerve? It's coming from the right vagus. So the right vagus nerve gives off what's called the celiac plexus. And the celiac plexus supplies the adrenal glands. It supplies the kidneys. It supplies the large intestine. Now, how far? It supplies the ascending colon. It supplies the transverse colon. It supplies the hepatic flexure, but it stops at the splenic flexure. So it supplies most of the colon up to the splenic flexure. It supplies the pancreas. It supplies the duodenum, the jejunum, and the ileum, the small intestine. It also supplies the spleen. Then there's another one, the left vagus. The left vagus is actually going to give off another branch here. Let's actually bring it in here because it's kind of ironic here where we're at. It gives off another branch, and this is actually going to be let's say this one right here is going to be the left vagus. So this one right here that I'm coming off to, the right vagus is this one. This is the left vagus. The left vagus is going to go to what's called the hepatic plexus. And the hepatic plexus is going to supply the liver, and it's also going to supply the gallbladder. Okay, so it's going to supply the liver and the gallbladder. But that's specifically coming from the left vagus. So what is this plexus right here called? This is called the hepatic plexus, which supplies the liver and the gallbladder. Okay, so to make sure that we understand this, coming down, it gives off bronchial branches which form the pulmonary plexus. What is the function of the pulmonary plexus? To provide basically fibers that can cause secretion within the lungs or might even cause bronchial constriction. It's going to give off superior, inferior, and thoracic cardiac nerves, which are going to provide the cardiac plexus, which serves the SA node and the AV node. If you want to be really specific, SA node is really innervated by right vagus. AV node is really innervated by left vagus. What's the purpose of this? To slow down the heart rate, okay? Negative chronotropic action. Then it's also going to give off another branch, over here, the esophageal plexus, which supplies the esophagus to have peristaltic contractions. Then from the esophageal plexus, it gives off the posterior gastric nerve, anterior gastric nerve, which allows for peristalsis and even secretion activities of the stomach. Then what happens? It gives off from the right vagus, you give off the celiac plexus, which supplies the kidneys, it supplies the adrenal glands, it supplies the intestines, right? So contraction and secretion of the intestines, both large and small, but it only goes up to the splenic flexure. It supplies the pancreas for secretion of pancreatic juices, and it even controls the spleen. And then if you remember from the left vagus, you're going to help to form the hepatic plexus, which supplies the liver for secretion of like bile and other different types of substances, as well as the gallbladder for gallbladder contractions to make bile, right, or to release the bile down into the duodenum. Then, what do we say moves with a lot of these? These GVA fibers, like the stretch receptors of the lungs or the irritant receptors of the lungs. You could even follow these suckers down here. They don't really have a cardiac branch, but they do have this esophageal branch. So if we follow this esophageal branch here, it actually gives GVA fibers to the esophagus. It actually moves with the celiac plexus here. It also gives off another branch that moves with the hepatic plexus right here. So if we give off another branch that moves with the hepatic plexus, what's it going to do there? It's basically going to give different types of visceral sensations from the liver or visceral sensations from the gallbladder. And it's going to give also GVA fibers that move with the celiac plexus to supply the adrenal glands, to supply the kidneys. It's also going to give GVA fibers that move to supply the intestines. This is probably of the most importance because when it goes to the intestines, if you have stretch of the intestines or irritation of the intestines, that would activate these fibers. If you have, the stomach, so even from here, from the esophageal plexus, it'll move into these gastric nerves to whenever there's stretch of the stomach. So if there's stretch of the stomach, it'll activate these general visceral afferent fibers of the vagus nerve and send it up to the medulla. If there's stretching of the intestines, right? Or it can even pick up sensations from the pancreas. It can pick up sensations from the spleen. So the whole point is that what? The thoracic and abdominal viscera is supplied by what? GVE fibers, which are the parasympathetic fibers. For what? Two things. One is going to be peristalsis or some type of glandular secretion, okay, of any of these structures that we talked about. Then the other fibers were the GVA fibers, and the GVA fibers were picking up sensations, certain types of visceral sensations. From where? From the lungs, from the liver, from the gallbladder, from the stomach, from the esophagus, from the intestines, the pancreas, different parts of the thoracic and the abdominal viscera. Okay? Now, with that said, what have we covered? We've covered the GVE fibers. We've covered the GVA fibers. Okay? And we've talked about the GSA fibers, the SVA fibers, and SVE fibers. We're not going to spend a lot of time about the clinical correlations in this, and the reason why is we're going to talk about it again when we talk about the parasympathetic nervous system. We're going to go into a little bit more detail. But what I want you guys to know is one of the biggest things that is usually important with looking at the vagus nerve is if it is damaged for whatever reason. Let's say that you have strep throat and you have to go in and you have to get a swab. And they go in and they try to swab the back of the throat, right? If they do that, they'll hit certain parts of the pharynx, activating the glossopharyngeal nerve, those actual GVA fibers. It'll take it up to the medulla, and what fibers will be activated? The vagus nerve. What does the vagus nerve do? It causes the pharynx to contract and some of the soft palate muscles to contract. What would that do? Gag, right? If the vagus nerve is damaged for some reason, you might have a negative gag reflex, okay? Or if for some reason the vagus nerve is damaged, the uvula, it does something really weird. It actually does something opposite of the hypoglossal nerve. Whenever the uvula is damaged, let's say that the right vagus nerve is damaged, the uvula actually leans to the opposite side. So it actually will lean to the opposite side. When you ask them to open their mouth, you'll see the uvula moving to the opposite side of wherever the lesion is occurring. So if the right vagus nerve is damaged, the uvula will move to the left. If the left vagus nerve is damaged, the uvula will move to the right, okay? So those are some other things that could actually happen. And obviously, if there isn't any other damage to some of these actual nerves that are going to the thoracic and abdominal viscera, oh my goodness, the horrors that could happen from this, right? So if some type of vagotomy occurs here in the cardiac plexus, then you won't be able to slow the heart rate down. You might not even be able to have certain types of secretion activities or certain types of peristaltic activities that are occurring within the abdominal viscera also. All right, Ninja Nerds, I really hope all of this made sense. I hope you guys did enjoy it. If you guys did, please hit the like button, comment down in the comment section, and please subscribe. All right, Ninja Nerds, as always, until next time.